mentioned that health insurance companies are the only business that there are no antitrust laws for.
They are specifically exempt under McCarran-Ferguson, yes.
So my question is, why hasn't Congress done something about that? Number two, you sounded like you were telling us that no limits, some policies have $1 million, some $2 million, but now we're going to pay for everything up to $5 million maybe, and we're not going to have any limits on pre-existing conditions. How are we going to survive as a country economically if it sounds like we're going to just take care of everybody with the government doing it? We haven't done very well on Medicare. Medicare is bankrupting this country. Everybody says, if you have Medicare, then you have the...
Come on, be quiet, let her finish.
Everyone says, if you have Medicare and you like what Medicare does, that's the government running an insurance company. And my understanding is, I mean, I keep seeing these ads on the television. Get a wheelchair. You don't have to pay $1 for it. Medicare pays 100%. Well, how long can we do that? Thank you.
Okay. Thank you. On antitrust, all I can say is the insurance industry got the exemption in 1946, before I was born. And, you know, William Proxmire, I'm sure, had been proposing to take away their antitrust exemption before I came to Congress. I've been proposing it for quite some time. They're a very powerful industry. I once, quick diversion, had the CEOs of all the airlines before the Aviation Committee, which I'm on. We were taking their terrorism risk after 9/11, but they were there saying, well, you know, but we also have these other huge run-up in our insurance costs. And I said, well, that's kind of odd. Why is that? Because, you know, you haven't had any accidents last year. And they said, well, we don't know, you know, but it went from like $200 million aggregate to over $1 billion for our liability insurance outside of terrorism risk, which the government took. And so I explained to them my bill about, you know, antitrust and said, you guys have to compete. You know, you raise the rates and someone else doesn't, you bring it back down again. I mean, you've got to compete. You can't collude. You can't go to each other and do that. And so I said, how about supporting my bill to make the insurance industry work the same way you did? And I didn't get any volunteers from the CEOs of the airlines. Everybody's a little bit afraid of the insurance industry in a lot of ways. It's a very powerful industry. So hopefully it will be allowed. When I brought it up leading up to this, you know, the break this summer, and I brought it up in caucus, everybody said, that's a great idea. And then leadership was saying to me, well, but it'll never pass. And I said, well, how about just letting me offer the amendment? If it crashes and burns, it's my problem, not yours. But I would find it hard for anyone, the most ardent free market advocate, you know, on the Republican side of the aisle, to say, we think the insurance industry should have special privileges and collude, unlike other businesses. I don't see how people would argue to keep it. I mean, the industry would, but I don't think members of Congress could. So on Medicare, Medicare has problems. You know, Medicare has 44 million people on it. Medicare was paid for in part by a trust fund, Part A, which everybody pays into out of all of their earnings. It doesn't have a cap like Social Security, so you pay the Medicare tax on all of your earnings, unlike Social Security, which is capped a little over $100,000. That's been paying for Part A. That's the trust fund. Part B is based in part in premiums paid by seniors, and about 2/3 of it, or a little more than 2/3, is paid for annually with appropriations. Part D, which was just added on, very expensive program, Medicare prescription, so-called prescription drug benefit, costs about $50 billion a year. So that's driving Medicare trust fund toward exhaustion very quickly. I voted against Part D, not because I don't think seniors need a prescription drug benefit, they do, but because it was written by the pharmaceutical industry. It subsidizes both pharmaceuticals and insurance, and then gives seniors a donut hole and not great coverage at a cost of $50 billion a year. If we repealed that, negotiated lower drug prices like every other nation on earth does with the pharmaceutical industry, we would save trust fund problem. But you also pointed to durable medical equipment, and I'm not going to defend the way Medicare acquires durable medical equipment. There's been scandal after scandal after scandal. We proposed reforms this year to get into a competitive bidding process there instead of the current process. And there are problems, as you mentioned, particularly the wheelchair or whatever, the durable medical equipment. And then one other point you made, lifting the a lifetime cap does not mean that every procedure is provided to everybody. It does not say that you have to give a heart-lung transplant to somebody. There will still be exclusions on these policies, things that won't be covered, that aren't covered today by many policies. So it isn't everything for everybody. Everybody's going to have to pay something for it. And what will happen is there's a large group of young people who feel fairly invulnerable like I did when I was young, and they don't have insurance. They're going to have insurance, and they will be sharing the risk with everybody, and that's part of the reason why some of the insurers and others out there support this, is they say, oh, look, we're going to get a lot of people who are very low risk, and our hope is we get those people channeled into these exchanges. Those will be very low cost premiums because they won't be high-risk plans, but they will have a few high-risk people in them. This is, the other thing is, of course, today, we don't deny anybody in America emergency medical care or critical medical care if you're deathly ill. But you go to the emergency room to get it. It's the most expensive care possible. And guess what? It's not free. So everybody who has insurance is paying it. The average in Oregon is $1,400 a year per policy for unreimbursed care and the increase in charges to pay for them. And that problem would go away. So actually, there's gains and losses here to make it affordable. Thank you. There were two other numbers I called. Did either of those